Hi, my name is Megan Ryan. I'm a student of physical therapy here at South College, and our patient today, her name is Betty. She is coming in with a right humerus fracture. She did this approximately 6 weeks ago, so she's coming in for just some pain modulation and trying to get through her treatment without pain. So for today, we're going to do conventional TENS, and we're doing this kind of, like I said, to modulate pain and symptoms so I can work with Betty to improve a little bit of strength and a little bit of range of motion. All right, so, hi Betty.
Hi.
My name is Megan Ryan. I'm a student physical therapist, and I'm going to be helping you out today, okay?
Okay.
So, before we get started, I'm going to ask you a few questions just to make sure that what we're going to be doing today is safe and that it's going to be comfortable for you,
Okay.
all right? So, first things first, do you have any history of blood clots?
No.
No? What about any pacemaker or cardiac disease that you know of?
Nope.
No? Okay. And do you have any history of tumors?
No.
Or recent tumors? No?
Mm-mm.
Okay, great. So, in the preliminary examination, I kind of thought that we didn't need to ask about pregnancy because we're going to be working on her shoulder, so it's not going to be near her abdomen. I'm also not concerned with the carotid sinus since we're going to be a little further away from there. I did check skin irritation. There's no open wounds. There's no irritation around where I'm going to place the electrodes. So from there, I can move on and tell her about the TENS unit and how it's going to work. All right, so Miss Betty, today we are going to be doing something called conventional TENS. What this is going to do is it's just going to feel like a light tingle, and what it's going to do is it's going to help kind of relieve your pain in your shoulder. That way we can go through and do some exercises and some more treatment.
Okay.
Okay? So like I said, it should feel like a little bit of tingling in your arm, and it shouldn't be painful, it shouldn't be too much tingling, and it should not feel like it's burning or itching where the electrodes are. Okay? So if you do experience any of those adverse effects, the tingling, the burning, the itching, please let me know. I want you to be as comfortable as you can be during this treatment and during your exercises.
Okay.
All right?
Mm-hmm.
Okay, so with that being said, I'm going to have you sit right here on this stool.
Okay.
Good. Do you mind if I touch your shoulder so I can expose it for treatment?
Sure.
Awesome. I'm going to drape you real quick.
Okay.
So I'm going to come around here. There. Just going to roll up your sleeve.
Okay.
There we go. Perfect. And then just to get you a little more comfortable, I'm going to put a pillow right up under your arm.
Okay.
How does that angle feel?
Good.
Good?
Mhm.
Awesome. Okay, so skin looks good, no irritation. I'm going to place one electrode on the posterior side of her shoulder on the muscle belly, right there. And then one on the anterior side on the muscle belly as well. There we go. Does that feel okay still?
Yes.
Awesome. I'm going to hook her up to some of the TENS unit. Okay, and for conventional TENS, what I'm going to be using is a pulse width of 80 for this machine, and then a pulse rate of 20, okay? And then I'm going to turn the intensity up. I'm going to do it until she feels a tingle, and then keep increasing it until it's a stronger tingle but not uncomfortable, okay? So I'm going to go ahead and turn it on. Here, let me go around so you can see me. Here we go, I'm going to turn it on. Let me know when you start to feel a little bit of a tingle.
Okay. I feel a tingle.
You do?
Uh-huh.
Okay. I'm going to turn it up just a little more and let me know when it gets to a point where you want to stop, alright?
Okay. That's good.
That's good?
Mm-hmm.
Alright. I'm going to put this here, and if it becomes a little too intense, I'm going to let you work with this. That way you can adjust the intensity as you need. Okay?
Okay.
Awesome. Okay, I'm going to leave this on during all of our exercises that we're going to do. That way the pain is relieved and it's under control and we can do our treatment as needed. Okay, so treatment is over. I'm going to turn off the intensity, unplug these electrodes, maybe, go, good. After I take these sticky electrodes off, I'm going to check the skin just to make sure there's no irritation, there's no redness, and there's no really adverse effects to the sticky pads. So I'm looking, and it all looks really good. All right, so for my pre-test, pre-treatment test, I already asked her what her pain was like on a scale of 1 to 10, and during the test, I'm gonna also ask her, and then following the test, I'll ask her again. Okay, so that's my pre-test and post-test.